So we got a guy coming in today. He's having some hip flexor issues. He's had a history of some back stuff too, and we had the unique opportunity to check out his MRI. He does have a bit of a herniated disc at that L2-3 area, so commonly we'll have an issue in the front of the thigh. The upper part of that lumbar spine tends to go down to the front part of the thigh. So we're going to kind of check the hip flexor and back and kind of see what the cause of the cause and what his main issue is. Let me just see you bend down, touch your toes, as low as you can go.
All right.
All right. Now extend up, hands on your hips, and go back as far as you can. Any pain with either of these?
I'm not done.
Okay.
No. Okay, so when I go that way, I definitely feel it in that lower right quadrant.
Okay.
And then here, there's no pain at all.
Okay.
Actually, just felt a little pop and it felt good.
All right. Was there any, is the right hip flexor you're having an issue with?
Yeah.
Yeah, and then so you felt a little bit of restriction on that side?
Yeah.
Gotcha. What about if you rotate like this?
So rotating this way, no problem. Here, and it's gotten better over the last few days. But,
Yeah.
But here, I still feel that same spot.
Gotcha.
As whenever I do that.
Okay. All right. Now go ahead and just do your squat how you normally would.
All right.
Good. So we can see a little bit of rounding through that upper part of the spine there.
Okay.
Go ahead again. Yeah. A little butt wink at the bottom. Good. Now show me a hinge pattern. So show me if you're gonna like do a deadlift. Right. Something like that. Yeah, not bad, not bad. He kind of extends through the upper part there. So we can see that that could be an issue on the way up. That's kind of right in that same area where we're having that issue. What we're gonna do today is we're gonna start looking at his paraspinals of his spine. So what you'll see oftentimes whenever people have an issue, herniated disc or something like that, there's a deep core muscle issue. And so then the paraspinals here will compensate for that. So we're gonna needle those to help those relax a bit. And then we're gonna go ahead and we're gonna be able to get down into the deeper core muscles and give them a little more relief of symptoms from there. So I'm gonna do 8 needles, 4 on each side. So gloves first, then we're gonna sterilize the area. So sometimes people have sensitive skin, so we try to go a little bit lighter on our entry point on the needles. So we'll go here, a little bit lighter. My dude's pretty caked up, so I could use his butt for a shelf here. Not bad. Left side's going pretty well. A little stiff, but not too bad. You can feel the sweat building up underneath my hands.
Feel it, feel it. Terrible though?
Not bad, yeah, not bad. Now we'll switch to the other side.
How'd that one feel?
Nice. Good, man. All right, so now we're gonna get him, gonna add a little bit of stimulation to the needles.
The fun part. Is it warm in here? Or is it just me?
Oh, the fun part about treating patients, you get the good results, obviously, but the dad jokes really are the coup de grace, as they say, on all patient care.
Who says that?
Somebody. Not me, but somebody.
That bottom left one,
Yeah?
that might be the worst one I've ever had.
Oh, man.
It more like stung and burned more than like, you know, like the deep achy feel. It's really just the initial, sometimes it stings just a little when it goes in.
Yeah.
But other than that, like, it's not bad.
Yeah. I tend to have that like skin sensitivity too whenever like I hit the needle. It's like, that's like the worst part is that first part. So we're getting a good little jump on the needles right there. secondary benefits, I guess, as well. How's that feel, Jay?
Yeah, that feels probably pretty good right
All
there.
right, man. So we'll let you hang out here for about 10 minutes, and then we're going to get us some more stuff.
All right.
Take these little electrodes off here.
So I had a dream while I was laying here.
What's that?
I had a dream that I met a physical therapist.
Mm-hmm.
I started working out at the gym
Mm-hmm.
like 5-6 years ago.
Yep.
And ever since the day I met him, he's been taking care of me.
Oh, man.
Anytime I get hurt, anytime I need him, he's there.
Oh, man. Well, it must have just been a dream then.
Wait, hold up. Wow. It's a reality.
All right, we got the needles stored away. We're going to re-sterilize the area there. So I had a little bit of soreness on that left side he was talking about, so we'll see what that looks like going forward. But let's go ahead, we'll move all this out the way, and then we'll have you stand up and just see how you feel. Not good.
Feels great. No, it does feel a lot looser than it did before.
Yeah.
Especially when I move to that side position.
That side's better.
It doesn't really hurt. I still feel it here a little,
Mm-hmm.
but when I turn like this, I don't feel any of that anymore.
Yeah. We should have had you do that rapid flexion
Before?
extension. That'd have been a good pre-test, post-test. I mean,
I didn't
like,
think about it.
we really want to have like functional tests that we can really see if you're getting better. So the better you twerk and stuff, the better obviously
I'll
you're getting.
do it again later.
Yeah,
So.
we'll keep monitoring it. All right, so what we're gonna do, we're gonna go ahead and have you lay on your back for me.
All right.
So we're gonna get a good old-fashioned thoracic manip here. So we're gonna go hands across your chest like this, give yourself a big hug, compress through here, like that, like that. Good. Then we're gonna look at hip rotation. We're gonna see where that's looking. So got a little rotation on the right. So his right hip is rotated a little far forward. So that would put pressure obviously on the hip flexor as it comes across. So we're gonna work on that a touch. There you go. Reset here. See where we're at on that. Better. Good. And then I'm gonna just go a little bit more to reinforce it. So we're gonna do what's called a muscle energy technique to try and reinforce that. So he's gently gonna push into my chest here. And relax. Go ahead again. Relax. One more time. And relax. Good. Sweet. Awesome. Good. All right, let's recheck.
So what am I doing right here?
So let's recheck that side bending that you did. Yeah. Quality looks better on that.
Yeah, I
That's
felt like
good.
I could get through further range of motion.
Mhm.
When I get towards that end range of motion, I still do feel it.
Still
a
feel it
little
right
bit,
there? Okay.
But it's gotten better.
Good. So you feel it kind of back in this spot
It's
here?
more like right, like everything's more right in this lower area.
More outer?
right
Okay.
there.
Gotcha.
Yeah.
So we'll do a little SI and then we'll do a little QL to add on to that. So let's go ahead and we'll lay on your side facing that way. So with this, I'm gonna go bring them up all the way.
Ooh,
I know.
tallest I ever been.
So we're gonna rotate the chest towards the ceiling, grab the table with this arm, and grab my wrist with the other arm. You're gonna take this leg, straighten the bottom leg, bend the top leg. We're gonna go like this here. Match my pull, 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 pull. There you go. Good. And we'll do the other side. Straighten that out like that. Rotate. Grab my arm. Good. There you go. Good. Now let's go ahead. We'll lay on your side again facing this way. what you're gonna do, this top arm, you're gonna bring it over the top and grab the top of the table. Bottom leg's gonna get bent up. Top leg's gonna be straight. Your hips are gonna stay stacked like that. When I say so, you're gonna pull your hip up to your rib cage. So hip goes up to your rib cage. Go ahead, and then relax. Good. Now go ahead again, and relax. One more time. And relax. Good. All right, so let's go ahead, we'll stand on up. Be careful, you're still pretty tall. Oh no, I might fall.
I know, I hope I don't fall.
All right, so
I hope I don't fall.
let's do that side bending, side to side. See where you're at. Yeah.
A little bit better.
Good.
Yeah.
Good. Okay. Gotcha. All right. So all the manual therapy in the world is not gonna. It's gonna help you feel better, but you have goals. You're a CrossFit athlete, master's CrossFit athlete. So you want to make sure that we're gonna load the tissues, that it's used to what you're gonna put it through. So we're gonna go out in the gym. We're gonna do some work with that. So we're going to start working on thoracic spine. Kind of when you get into that upper lumbar, you're getting into that TL junction, thoracolumbar junction. So we're going to start working on that. So what you're going to do, you're going to get into this position. So you're kind of here like this. So go ahead and try that for me. So scoot up on the table and then just drop your butt down. So by dropping your butt down, you're locking out lumbar spine, and we're getting into that upper lumbar, but mostly into that thoracic spine. So what you're gonna do next, you're gonna take this hand and put it behind your head like that. Now, we're gonna check your rotation. So you're gonna rotate up to the ceiling. There, okay, come on down. Now we're gonna go up again, and I'm gonna give you a little overpressure. So you're gonna come up. Now push down into my hand and relax. Good. Come down. We're going to do one more like that. So we're there. Pull. And relax. Good. Now we're going to do the other side. So I'm going to flip sides. There. So you're going to rotate to the ceiling. I'm going to give you a little overpressure. Relax. Good. Come on down. We'll do one more like that. So we're there. Push. And back. Nice. Good. All right. Good. Now we're going to the gym. All right, so oftentimes what we'll find is that whenever you're having a disc herniation or anything in the low back, it causes everything to kind of shift forward. Okay. So we want to try and put the opposite pressure onto your spine to help make you more resilient to that movement. Okay. So what we're going to do, instead of doing a traditional deadlift with this weight, we're going to do a sumo deadlift. Okay. So that tends to put a little more of that posterior shear or posterior force on your back. So you're going to get here, your toes are pointed out, your belly's nice and tight. Using those legs, pull it up like that. There. Okay. So let's try that. So belly tight, yep, there you go. Big brace, good, like that. Up and down. Let's get about 10 of those. Good. Yeah. Good. How'd that feel?
Not bad.
Not bad?
I feel that all in my back.
Good. Yeah, so that's a good way to load the spine and to give you more of that, like I said, more of that resilience into that hinging pattern. Now let's just try a regular deadlift. Let's just see how that feels. So we're just gonna go here, get that good hinge pattern. Belly tight. Yep, there you go. Nice brace. Good. There you go.
So it doesn't hurt, but I feel it.
You feel that spot?
Like it's not painful, I just feel when I move through that range of motion, it's something there.
Something catching? Okay. So what I want you to do then, let's focus on whenever you're setting up, think about trying to fill your belly up there. So instead of trying to like pull yourself up, think about trying to like pull, like it's almost like if you're wearing a belt, right? So if you're wearing a weight belt, the way a weight belt works effectively is if you give pressure back into it. So it provides pressure, you provide the pressure into it, that's where you're the most stable. Okay. So whenever you get down there, so we're here, think about setting up, think about big brace. So you're trying to like fill your belly up here and then pull from there. So let's see that. There. So fill the belly through here. So fill the belly with air. Good. Now pull. Keep your eyes looking slightly in front of you like there. Good. There you go. So in a perfect world, like fill that belly up, get that good brace, and you should be able to talk. Like I have that, I'm holding that right now, and I could talk. It just takes a little bit of like practice with that. So it's,
yeah, holding it right now, I'm talking. I feel like, yeah.
It's good. It's hard to do it on when you're doing something like this. I'm doing like a front squat. You get on that front squat, you back up. It kind of almost like puts you in that position, and then from there you can squat down like that. Yeah. So let's just try. This might be a little heavy, but we can try it. So we'll kind of go here. This might be a little heavy, I don't know. But we're gonna try and go here. Get that big brace. Squat straight down like that. Keep it there. Yep. So fill this whole belly up with air and squat straight down. Good. Give me like 3 more if you can. How'd that feel? Anything there?
I didn't feel it, anything.
Good. So that's a good way to work on, working on that brace under a load, you know, so making sure that you're staying stable through all these motions. That's good though. I like that.
Felt good.
Yeah, dude, solid. All right, so let's go, we'll go over to the bench there. We're gonna work on some of those hip flexor lowers that we did before. So for this next part, we're gonna work on the hip flexor itself, right? So the hip flexor attaches to the low back and it goes all the way down to the hip. So we're trying to get him to be stable from both ends and work it from both ends. So you're gonna lay on your back here. Good. You're gonna take one leg, you're gonna bring it up and grab it like this. The other leg, you're gonna put this kettlebell on it. You wanna keep that foot up there. Now you're trying to bring that up bring that knee up a little bit. Keep that back flat the whole way. Try to add some tempo, so try to lower nice and slow down. And back up. Good. Whole time he's thinking about keeping those ribs down, keeping that back flat. This left leg being grabbed is going to help to keep that back flat, and it's trying to help him control the core while the leg is moving. It's also working the hip flexor. Good. Then we'll flip sides. There you go. Good. He's doing pretty well. This is a 100-pound kettlebell, so he's doing pretty well with that.
Yep. It feels like, only feels like about 90 today.
That's good. It's a good day.
You know, feeling pretty good.
Good. All right. Last thing we're going to do, we're going to start working on the adductors. So the adductors are good for stability in the SI joint. They help with low back health. They help with squatting. All the things that Jeremy here is having trouble with. So we're going to work on that. So he's going to lay on the ground and kind of straddle the bench here. Good. This top leg is going to be supported right here. Hips are going to be stacked on top of each other. So bring the hip forward a little bit. That bottom leg is going to come up. And he's going to hold that. You're going to rotate a little bit more forward here. Good. Like that. Good. And you're feeling a nice shake in that adductor region. We're doing about 10 of those on each side. How you feeling there, Jeremy?
Little shaky.
Working that sweet meat, man. I like it.
Shaky.
I gotta bring those hips forward a little bit more.
Yeah.
There you go, like that. Good. Yep. Nice.
Does it matter if I can't touch my leg to the bench?
That's fine. Yeah, you're trying to get it up as high as you can. All right, so let's check you out, man. So let's go. I know that side bending was a big thing for you.
It's less. It's still there just a tad, but it's definitely not as bad as it was before.
Good.
And I could move a little bit further through that range of motion. And the twist really
nothing.
I don't think there's really anything there anymore. So
Good.
that's definitely gone.
Good.
Yeah.
Good. 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 Now let's check your squat out and let's see how that looks. A lot better. Not as much rounding there. Good. Yeah, I like that. I like that. Good. Now we'll do that kind of hinge, so just hinge forward and just see how that looks. Yeah.
Yeah, that just feels like it doesn't hurt at all anymore.
Good.
I feel that in my hamstrings now where
Good.
it's supposed to.
Nice. I like it. All right,
Yep.
good job, man.
All
Nice
right.
work. Pleasure.
Thank you, sir.
Yes, sir. So pretty cool session overall. You know, we kind of came in mostly with the hip flexor stuff that he was having, but then, you know, as we dove deeper into his back and his hip and all that stuff, we kind of noticed that there was, you know, some improper movement patterns in there. So if we don't take anything away from today, just don't take things for what they're worth, you know, or for what the patient says. You want to make sure that you're doing your research and that you're diving deep into what could be the cause of the cause. So if we would have just treated his hip flexor, he probably would have gotten better. But would he have had the long-term relief that he wanted? Probably not. So we got to really address his total movement patterns. And I love to get out in the gym and really like break a sweat, obviously myself and with my patients, to where we're loading it and we're getting it used, getting the tissue used to what it wants to do and what the athlete wants to do. So we're getting out there and we're really working hard. So hope you guys enjoyed. Let me know if y'all have any questions, drop them in the comments. We'd love to hear from y'all.